everyone, it's Tika again, and today I would like to present about my part, which is about my DB part, for my article individual assignment, which is for my title for this article, which is Factor Intention to Use e-health among elderly. Alright, so for the first of all, about the introduction. Right, for the introduction, as we know, in healthcare, is the definition hopefully is brought enough to apply to a dynamic environment such as like internet, and at the same time acknowledge that e-health encompass more than just internet and medicine, and such as the E for in e-health, so does not only stand for electronic review, LR, which is literature review, which is we have five six literature review, which is we have start for IV, 5 IV and 1 DV, which is first for my DV, which is intention to use e-health. Yeah, so according to website regarding to policy, they said the e-health we know now has increased become an interesting field for the exchange of medical informatics and education related to the health of patients and professional, public health and business. Started for IV, which is we have a performance expectancy, which is the factors are firstly performance expectancy, which is the degree which is an individual belief that using the system will help him or her, also referred to as a perceived usefulness. Yeah, that about the perceived usefulness based on the article is the subjective belief of the users associated with the numerous benefits of his use to achieve the goals of the job in clinical practice. Yeah, clinical technology and society, which is as our ever evolving digital use technology has become a part of our daily life. Yeah. So next IV, which is a social support. So the social support which has been found is instrumental in a user's intention to adopt technology. We employ to test relationship between four major factors of the FASA 1L community Bandar Tasik Kesuma at Beranang Selangor, and in which is for to in the acceptance for to see in acceptance of e-health by the elderly in Malaysia. For the firstly about the DV for my part, which is if we can see that for DV intention to use e-health, based on the alpha result, we can see that for the DV question, which is that the result is unacceptable, which is for the intention to use e-health. It shows that a few participants not really accept the question statement maybe. So second, about the IV. Alright, so for basically for IV, which is based on performance expectancy, that we can see the result is the result of a performance expectancy is a poor. Is poor, which is it means the participant may have a low expectation about the outcomes or benefits of using e-health. Third IV, which is the result that we can see for alpha result, which is the result for the third IV, which is questionable for facilitating conditions, which is the question part, which is that part, which is it is implies some doubts or ascertainings regarding the condition that make e-health adoption easier. So for fourth IV, which is for the next IV question part, which is the result is acceptable for social support question. So it indicates that there is an acceptable level of social support for the elderly in adopting e-health. So next for IV part, which is based on the result, is a good. We get good for the technology anxiety question part, which is we can see from the result, it most like it suggests that on average, where there is a low level of anxiety, which is the result is good also for perceived ease of use for the question part, which is we can see maybe it is implies that the elderly generally find e-health user friendly and not over complex. So based on the choose, based on the question, based on the result alpha that we got, which is we can see the alpha data result, which is the result show is excellent, which is we got the excellent result for perceived usefulness question part, which is it indicates that participant highly appreciate the usefulness of IHA and very positive and encourage result from the participant. Respondent demographic, we have a gender, age, occupation, education level, and race and experience using IHA. So for our gender, the most highest we get is men, yeah, which is 54. For the age, for mostly in our participant respondent, that we got the age range of 41 to 50. Yeah, so the frequency is 41. Break from the occupation, which is more like the private sector. So the private sector is 34 respondent. So next about the education level. So for the education level, mostly we got the bachelor degree is the more highest bachelor degree that we got. The frequency is 51 that respond our questionnaire. Mostly more is among the Malay people that respond our questionnaire. So which is we got the frequency is 77. Yeah. So next about the next our demographic, which is experience to using IHA. So mostly our respondent is have a experience to using the IHA. So for the frequency we got the 56 for the experience to using IHA. It's about the correlation result that we got from our study for the questionnaire. So based on data, we can look the correlation, which is first about the perceived usefulness. Is a low positive between behavior intention, which is the both significance level. Significance values are under 0.01. So it's the less than the highly significance, which is 0.05. Yeah. So it shows a significant statistical relationship between the perceived usefulness and behavior intention. Right. So the perceived is of use. So we got the same under 0.1, which is the less than highly significant 0.05. It shows its significance levels statistical relationship between the perceived usefulness and behavior. Perceived is of use and behavior intention. And same like the facilitating conditions and social support and the technology anxiety and yeah and other that. We can conclude that discuss the necessary findings on perceived usefulness, perceived ease of use, and technology anxiety, social support and facility condition, also performance, expectancy, and intention to use IHA. So the study objective will achieve the research question will answer and the hypothesis will confirm and accept this study. And based on the analysis of the total of 107 respondents that we got, so the overall relationship it show in the study is between intention to use IHA. So this research can help other researchers and researching the experience of using IHA. So and can be used as their reference. Yeah. So that's all for me, for my part, for my article presentation. So yeah, that's all for me. So thank you.